Bismillahirrahmanirrahim. Absorption and excretion of calcium and phosphate are discussed in this video. The daily intake of calcium and phosphate is 1000 milligram per day, that is equivalent to the amount that is present in 1 liter of the milk. It is absorbed poorly through the intestine and promoted by vitamin D. The calcium absorption is promoted by vitamin D, and this vitamin D is essential for boosting of this absorption. The 35% of the amount is absorbed by the intestine, while 65% or 650 mg of the calcium is excreted in the feces. There are additional 250 mg enters into intestine through juices of the gastrointestinal tract and the sloughed mucosal cell. So the total fecal loss measures about 900 milligram per day. The phosphate is comparatively easily absorbed from the intestine, and it is much more efficiently absorbed than the calcium. And the phosphate is minimally lost in the feces. Usually, the amount that is lost in the feces is in complex with the unabsorbed calcium, but major excretory route for the phosphate is through urine. So this table is summarizing this calcium and phosphate absorption. Daily intake for both is about 1000 milligram per day, and 350 of the calcium is absorbed and almost all of the phosphate is absorbed, and fecal excretion is the ingested 650 along with 250 milligram that comes from gastrointestinal juices and the cells from the epithelial cells of the gastrointestinal tract, and they uh, collectively they weigh about 900 milligram per day, and the major route of this loss is feces, while the fecal excretion of the phosphate is minimal and major route for their loss is urine. So the body calcium is about 41% is present in the bound form with the plasma protein, while 9% is anionic bound and 50% is ionized. So this protein bound or calcium is not filtered, while the anionic bound and the ionized form of the calcium, they are filtered through glomerular duct, and out of these 99% is reabsorbed, while only 10% of the ingested calcium is excreted, that accounts for about 100 milligram per day. And the reabsorptions occur, 90% of the reabsorption occur in proximal tubule loops of Henle and early distal tubule, while 10% of the reabsorption occur in late distal tubule and collecting ducts. So whenever there is decreased calcium concentration, this absorption is 100%, while if there is increased calcium concentration, so at the excretion increases, and this is parathyroid hormone controlled. This table is summarizing the fact. The excretion of the calcium is about 100 milligram. Daily intake is about 1000 milligram or 1 gram. So it is 10% of the intake. The binding of the calcium, plasma calcium, is 41% is bound to plasma protein that is not filtered, while 9% bound to anion and 50% are ionized form. So they are filtered by the glomeruli, and 99% of the filtered calcium is reabsorbed by the kidney tubules. 90% is reabsorbed in proximal tubule, lopophenol, and early distal tubule, while 10% is reabsorbed in late distal tubule and collecting duct, and these are regulated by parathyroid hormone. So if there is high blood calcium concentration, there will be increased excretion of the calcium, and if the calcium concentration is low, the kidney excretion of the calcium is almost zero. The renal phosphate excretion is by the overflow mechanism. So normally all filtered phosphate is reabsorbed in the renal tubule, and no phosphate is excreted in the urine. So the critical value is less than 1 millimole per liter. Above 1 millimole per liter, the kidney cannot reabsorb all the excess phosphate. Excess phosphate is excreted in urine. The amount excreted is directly proportional to the extra phosphate above the threshold. So the kidney regulate extracellular phosphate concentration by adjusting the rate of excretion, rate of filtration, and the threshold absorption limit. And the parathyroid hormone increases the phosphate excretion dramatically. It reduces phosphate reabsorption in the proximal tubule, help prevent phosphate buildup while preserving calcium, and balances both calcium and phosphate level in the plasma. So the excretion of the phosphate is by overflow mechanism. If the plasma phosphate is less than 1 millimole per liter, there is 100% resorption and there is no loss in the urine. While if it is more than 1 millimole, the excess phosphate is excreted proportionally, uh, and it is controlled by the plasma concentration and parathyroid hormone that greatly increases the excretion of the phosphate and help maintain calcium phosphate balance. Thank you for watching this video. If you have any query, please write in the comment box.